Bismillahirrahmanirrahim. Discover the light in dove. Between 9 and 30% of reproductive aged women have menstrual irregularities requiring medical evaluation. DUB accounts for around 20% of gynecology office visits. The history of the light technology. For over 50 years, Dupaston has been made in a unique way to deliver its unique efficacy and tolerability profile. This has been achieved with a singular manufacturing process in which light technology is used to bend the dydrogesterone molecule into a curved retrosteroid structure. Choose Dupaston for its favorable tolerability, highly selective for progesterone receptor, is non-sedative, is non-thermogenic, does not inhibit gonadotropin release and ovulation, shows no androgenic and glucocorticoid activities. Choose Dupaston to deliver benefits to your DUB patients. Dupaston restored normal means in 91.6% of the patients after cycles of treatment. Does not have a blocking effect on HPO, hypothalamus, pituitary ovary axis function. Pituitary ovary hypothalamus does not inhibit ovulation in the therapeutic dose range, does not inhibit own sex steroid hormones production, well tolerated, has no estrogenic, androgenic, and glucocorticoid effects, not thromogenic in the therapeutic dose range. Average prescribing information Dupaston indication. Hormone replacement therapy to counteract the effect of unopposed estrogen on the endometrium in hormone replacement therapy for women with disorder due to natural or surgical induced menopause with an intact uterus. Progesterone deficiency. Treatment of progesterone deficiency such as dysmenorrhea, endometriosis, secondary amenorrhea, irregular cycles, dysfunctional uterine bleeding, premenstrual syndrome, threatened and habitual abortion associated with progesterone deficiency, infertility due to luteal insufficiency, doses and administration, hormone replacement therapy. In combination with continuous estrogen therapy on tablet of 10 mg dydrogesterone daily during 14 consecutive days per cycle of 28 days. In combination with cyclical estrogen therapy on tablet of 10 mg dydrogesterone daily during the last 12 to 14 days of estrogen therapy. If endometrial biopsies or ultrasound would reveal inadequate progestational response, 20 mg dydrogesterone should be prescribed. Dysmenorrhea 10 mg twice daily from day 5 to 25 of the cycle. Endometriosis 10 mg 2 or 3 times daily from day 5 to day 25 of the cycle. Continuous dysfunctional bleeding 10 mg twice daily for 5 to 7 days to arrest bleeding. Dysfunctional bleeding 10 mg twice daily from day 11 to day 25 of the cycle to prevent bleeding. Amenorrhea and estrogen once daily from day 1 to 25 the cycle Together then 10 mg dydrogesterone twice daily from day 11 to 25 of the cycle. Premenstrual syndrome 10 mg twice daily from day 11 to day 25 of the cycle. Irregular cycles 10 mg twice daily from day 11 to day 25 of the cycle. Threatened abortion 10 mg 40 mg at once, then 10 mg every 8 hours until symptoms remit. Habitual abortion 10 mg twice daily until the 20th week of the pregnancy. Infertility due to luteal insufficiency 10 mg daily from day 14 to 25 of the cycle. Treatment should be maintained for at least 6 consecutive cycles. It is available to continue treatment for the first few months of pregnancy as prescribed under habitual abortion. Contraindication: hypersensitivity to the active substance or to any of the excipients. None of suspected progesterone dependent problems. Undiagnosed vaginal bleeding, if used to prevent endometrial hyperplasia in women using estrogen. Contraindication for use of estrogen in combination with progesterone, such as dydrogesterone. Undesirable effects: like all medicine, duphaston may have side effects. The frequencies of study-related adverse events are ranked according to the following: common frequency 1 to 10%, uncommon frequency less than 1%, rare frequency less than 0.1%, very rare frequency less than 0.01%. Included isolated reports. The undesirable effects reported in clinical trials and or post-marketing experience following dydrogesterone therapy are blood and lymphatic system disorder, very rare; hemolytic anemia, rare; increase in size of progesterone dependent neoplasms. Reference: Dangal G. Menstrual disorder in the adolescent. Reference: Dangal G. Menstrual disorder in adolescent. Internet. Manuveric management of dysfunctional uterine bleeding based on endometrial thickness.